morning, everyone. Today we would like to continue with the series we started about transplantation. And I'm so happy to have here one of my best friends, Petzalesha from Italy. He was transplanted 4 years ago, and I would simply like to know from him how it has been from the end of the transplantation until today, how he's doing and what tips he can give us, what one must do, what to watch out for, and so on. This is simply a subject that is regularly talked about, and we want to cover it a little bit. How does one feel when, as we've heard, the donor cells are slowly introduced into your body, and that it takes a while, 30 to 60 days, until these cells have settled in your body. How was it for you? How did it go for you? Was it very hard? No, it's especially the days before when you were in the hospital. To get 4 or 5 days of strong chemotherapy to wipe out all the cells in my bone marrow, the cells, the sick cells. My entire bone marrow was destroyed completely in 5 days, from Monday to Friday, 4 or 5 days, so that it was ready to receive the new cells, the donor's stem cells, because they must nest there where the others are no longer present. Does it hurt, or do you feel very bad? You don't feel anything. There is no pain at all. For example, when the donor cells come, in my case, I later traced it. It came from Frankfurt. The donor was a German young man, 22 years old, 100% compatible. And then it was sent down with Alitalia to Rome. I was able to research everything, how it works. It was then brought very quickly into the hospital in Rome, placed into lukewarm water, the same temperature as the body, in a small little bag. It isn't like blood, it was pink in color, about 250 grams, and it was then introduced into the vein, like any transfusion. And you feel nothing at all, nothing. That is the secret, the mystery, I would say. Yeah, the miracle. Yeah, the miracle, yeah, you could call it that. Otherwise, one cannot really understand it. In the following days, many tests are carried out to see whether it has actually integrated well and already started. In the very first days, you can already check whether it has worked. A small biopsy is done, and you can already see in the bone marrow whether it has nested. That goes fairly quickly. Within 30 days, everything must already be functioning. And what does that mean? You're just lying in bed, and then you feel the entire transplantation in the days afterwards because of the strong chemo, because the body no longer has any defenses. You're in a sterile room, and everything must be sterile, because any little bacteria could kill you. Yeah, you have no defenses, right? Yeah, none at all. But I did have pneumonia afterwards, and they had to use a lot of antibiotics. That can happen. It can even happen in the body from before. Who knows? But they managed to eliminate the pneumonia, and in 3 or 4 days it was gone. That can happen. It happens with many things, and then you just stay in the hospital, and afterwards you notice that you no longer have any strength. This chemo, you lose your hair, everything, it goes quickly. Within a week, everything is gone. And it is not a therapy, a chemotherapy. And it was more like an erasing therapy, so to speak. There are several people in that same area in the hospital, maybe 5 or 6, who are having the same transplantation, but you have no contact with the others because nobody can enter the room and so on. Then it already starts depending on which kind of transplantation you have. I had transplantation not from a family member. My body does not want to accept something like that. It's a stranger that enters. So then you have to take certain medication. It's called cyclosporine. It's a drug that you take for about 1.5 years with decreasing doses so that the body doesn't reject the intruder. Exactly, yeah. But that's only when you have a donor from a non-family donor. If the donor is a family member, like a brother or sister, that doesn't happen because genetically it matches. I didn't have that, but it was still 100% compatible, and so it just took a longer time until my body got used to it. It took about 1 year and 2 months until my body adapted, but then I was able to stop everything and I had no reaction. I had no strength, which is what people sometimes experience today. This is a reaction that sometimes someone has against this bone marrow. Yeah, exactly. But in my case, it worked well. It just takes time. What it does, though, is cause a change of taste in the mouth. Maybe at the beginning, everything no longer tastes as good. All food tastes bad and bitter from the medication. There is nothing you can do, and then little by little, it decreases as soon as the body no longer reacts. The quantity is reduced every 2 or 3 months until one day it is stopped completely, and then everything comes back. The taste comes back, and food tastes good again. Before it was really bad. I thought if it's always like this, then you don't even feel like eating anymore. But in the end, it stabilized again, and that's something you can only say if you've gone for a transplantation. So you lost quite a few kilos, right? Yeah, 20 kilos. Wow. And how long were you in the hospital? A little more than a month. Well, but then at home you also had to be careful with many things, right? Yeah, a lot. It still takes a long time afterwards because you continue with this medication, with this cyclosporine for over a year, and when you've been lying down for so long, already in the hospital for a month, the muscles deteriorate in the body, and you also can't walk properly. You have to learn how to walk again, to start again. Nobody has a strength then because there is not much energy, and it's difficult to describe. Yeah, the muscles are no longer there either. Yeah, exactly. But then a physiotherapist came, taught me again how to walk, to go upstairs, and so on. Really, I'd say I was disabled, physically disabled. But you live, and you have to admit that you live. Because once it has turned into leukemia, there is nothing more you can do. There are people who are already in that stage, and that then you have to transplant immediately. You cannot wait. Yeah, exactly. And then you can't wait long for which donor comes. You take the first one available, right? Exactly. And tell me, in Italy, how is it seen, the survival rate? You hear different things, and depending on the donor, doctor, everything is explained a little differently. Yeah, it's not as they say it's different. Let's say out of 100% who should be transplanted, precisely 30% die beforehand because they don't find a compatible donor in the critical time. There are those who wait 2 to 3 years. There are complications in finding a donor and they are already gone. 30%. Of the other 60% who remain, another 30% has problems. The transplantation did not go well. They relapse. There are many relapses, the body does not accept it. And you can't immediately do the same transplantation again. It doesn't work to go into another one right way. You have to do therapy so that it works, or you have to wait at least 2 years to do the next one because the body can't handle doing a second one right away. So 30% has complications after the transplantation. Those who make it are only 1/3 without problems. Just 1/3 without problems. 1/3 with problems and 1/3 never make it to the transplantation. When you say they have setbacks, does that mean that suddenly the new cells are not accepted? Yeah, the body rejects them. And then the JAK2 comes back again. There is a relapse. There are some from whom the white blood cells drop again, so there are many problems, which are more technical for the doctors, but then they do hormone treatments, all kinds of things. There are so many measures to try to proving it. But you can't be transplanted again, the body cannot handle it. If it has to be done again, a few years must pass because now therapies are done, immunotherapies and so on. I have already seen others who had problems who then have to have continuous transfusions. Because normally you need several transfusions, as in my case, until the stem cells are taken in by the body. In my case, I waited March, April, May, June. So for me, it took 5 months with blood transfusions until my body, my cells, started to produce it again. It doesn't happen quickly, almost 5 months. Yeah, in summer it was a problem because in summer there are fewer blood donors everywhere because they are on vacation, and my hospital was smart. You didn't just go whenever, but only when the blood test showed you were already under 7 hemoglobin. They would call you, and when the blood was available, they would tell you to come back. Otherwise, you have to spend the whole day waiting at the hospital until blood arrived, so I would have to go there or be taken there. Because if it's under 7, you can hardly walk anymore. At 6.5, you can no longer stand up, the strength is gone. And then you get a transfusion of 500 milliliters for 100, I don't know exactly how much. And immediately you feel strength returning again when the hemoglobin is back. But that only lasts a certain time. Then it drops again because there is no supply. And then suddenly I saw when I went again for a blood test, it was stable. It was no longer going down. And that was the sign. Now the body has started to produce and then it goes quickly. Sorry, how many blood transfusions? I don't know, I didn't count them, but at the beginning, one every week. No, at the start, even more, twice a week. Then once a week. And then suddenly it begins. The body starts to produce on its own, and there it goes faster. As soon as you are over 10 hemoglobin, if you don't have another medical disease, then it comes quickly. And the hematocrit is still in 40. Yeah. For you, it took 5 months until your own bone marrow produced blood cells again. Is that normal? Is it an average failure? Yeah, sometimes it takes a bit longer. Mine was actually quite short. For me, it went quickly, but it can also be 6 or 7 months. It depends on the person. But if everything works well, that's about the time it takes when everything is functioning. And you notice it yourself. You already feel much better. Before, when you have no strength, you can't walk properly or stand up and so on. But it takes time. Afterwards comes another year, even the second year, when you still have other problems, especially if you have had the transplantation. You're examined a lot, the lungs are checked, because the lungs are strongly affected during a transplantation. That's why I had to do a lung function test every 2-3 months, blowing into a device. The airways must work well. The whole system is affected. The whole body is not only the bone marrow, many things are affected. Besides the muscle, sometimes the liver. Yeah, the liver, the kidneys, and so on. Yeah, the liver, kidneys, certainly everything, because basically the chemotherapy is also a poison. I mean, poison. It is not good for other parts of the body. I mean, yeah, the bone marrow was destroyed, but other parts of the body also suffer, especially the liver, because it filters all that stuff. And you simply have to eat well, drink well, logically no alcohol, none of that, because you're still taking many medications afterwards. The cyclosporine, that is something else, but there were many liver medications that were used. Yeah, you took an enormous amount of pills. Yeah, a lot. Yeah, very many different things, so that other organs are not damaged, that circulation is good, or diuresis, and what, slowly afterwards the medications are reduced, but that already takes almost 2 years, up to 2.5 years, until almost everything is gone. Not everything, not yet. Now I actually don't take anything anymore for this thing. So practically after the transplant, you need 2 to 2.5 years until you're totally out of danger. Yeah, until you have stopped all the medications. And then you also feel very good again, right? Yeah, it goes well. Then the strength comes back, the muscles. You also have to do a bit of sport again, not intensive, but for example, now I go twice a week with training group where we work the muscles, the legs, everything, and it actually feels good. Although sometimes it's hard too, because it also hurts. You have to stretch the muscles and so on. You also do it. That's because of the age. I'm not so young, and you even less so. No, no, we are not. But what I wanted to say is this transplantation. How can one say? It makes you age faster, in my opinion. I'm just 62 years old, but it has already taken a toll. The whole thing. The illness before for 14 years, and then you come to the moment where the transplantation must be done to stay alive. And for example, I almost lost my entire vision. I mean, I also had eye surgery because before, due to the inflammation, I had taken a lot of cortisone, and that takes away your vision. Then with eye surgery as well, and many things add up. Then the years go by faster. At the beginning, everyone says, yeah, you're newly born. Okay, I stayed alive. You could say, better say that. Of course, I have a second birthday, but I'm happy that this way I can talk to you. How old are you? Still 62, 63 this year. That's nice. I had PV at 47. And I thought, what? Yeah, it's going to be a long path of suffering. Yeah, I thought it would develop like in your case, because most people have this PV their whole life. And in the brochure you get about PV, it was written that between the 10th and 12th year of the illness you can move into myelofibrosis. It didn't necessarily have to be the case for me, but it happened exactly as it said there. In the 11th year I moved into myelofibrosis. It matched exactly. Well, I've had it now for 30 years. Yeah, but I thought it would go like in your case, and it didn't. Yeah. Knocking wood. It's a matter of luck, isn't it? Yeah, it is. And then when the cells go higher again, when you had this PV, your allele burden was controlled. The allele burden, I think you don't know it. This is the, it checks how big this JAK2 is. How damaged is it? Ah, yeah, you mean the percentage. Yeah, the percentage. Yeah, they did this twice a year for me. And the last result was 80%. Yeah. 78, 80, 85 more or less. So it was always that high for you, or how? No, not so much. At the beginning, 40, 50, 60, and over the years it kept going up. And then as it went up, that's when you started having problems, right? Yeah, in the last period, 75, 80%. And then suddenly I can explain how this transition happened, because I felt fine. We were still going skiing up to South Tyrol. And then, no, before that, I went to Turkey because my wife was down there at a conference and I was traveling at night. We were to Istanbul, and suddenly at night, I already had, how do you say it, these night sweats. You get that with PV. But suddenly I was completely soaked. The whole body, totally drenched. I had to change twice during the night. And that lasted 3 or 4 days, and that was no longer normal. That never happened to me before. And then we returned to Rome, and then I told them at the hospital. And then they told me that they wanted to do another biopsy, that they need to do a bone marrow biopsy to see what has changed. And then they did it. And then they already saw that I had gone from polycythemia vera to secondary myelofibrosis. Yeah, BMF. Yeah. Secondary. And they also saw that I was no longer PV, but that I was now BMF. And that's why when these transitions happen so quickly, you already have to think about transplantation, because the body is no longer stable. And then they already saw in the new analysis that I had precursors of leukemia. So the hematologist at that time said, we must quickly find a donor because we don't know how fast things will go. If it progresses into leukemia, we have to find a donor immediately. At that point, you can no longer waste time. You can even accept a donor who is not 100%, who is 80, 70, or even 50%, because it can also be your son or daughter who are always 50%, because they always have part of you. Yeah, of course. As soon as there are signs of acute leukemia, you have to act quickly. Yeah, you must find a donor in the international register. And now I participate in the Italian Adenauer group, which is the donor group, where I give testimony in schools, universities, and also military schools, explaining that they could also become potential donors and register. The more people there are inside, the more chances one has of finding someone. Only one out of 100,000 is compatible. Is there a list, a donor list? How many donors are there? Well, I only know of some countries. Italy has only 500,000 potential donors. Out of 500,000, we only find 5 compatible per year. Germany, I think, has 9 or 10 million. And the ones who have the most are the Americans, right? No, the Germans. I had the German donor. People often mention the Americans, but the Germans are the ones who have the most. That depends on the health insurance policy. The second country in the world is Israel. Because all military must be entered in the international register, they must make a protective donation. The more people are inside, the more chances you have of finding someone. That should actually be the case everywhere, right? Yeah, it should. Every country does it differently. Here in Spain, we probably have much fewer. In Spain, I don't know how it works. I also have a good friend of mine here in Spain. He has now been waiting since last summer. He has been waiting for a donation and they haven't found one. That actually happens quite often in such cases. He can then find donors internationally, not just from Spain, from everywhere. I found the website, yeah. I found the website. And now I'm waiting for this AFL number. What is it called? HLA. Yeah. When, for example, we are in the hospital to get a special blood test called HLA from the hospital. For me, there are many numbers, like in the matrix. There are hundreds and hundreds of numbers in it. And then I have to match exactly in the HLA. Just as I found my donor, and mine matched exactly on the top of me, on the bottom him, all the same, all the same. How many numbers are there? Those are HLA numbers from HLA. Is it the long number? When they match, then you are 100% compatible. And then it is uploaded to the website, to this international register. And as soon as a match comes up with someone else, then the hospital and hematology and your hematologist are immediately notified. Back then, they found 2. And one maybe, it could be that he had done the HLA years ago. Either he had died or he was no longer available or something had happened and he was no longer in it. And the other one, a young man, he was 22 years old. He was still there and he gave it to me. You saw he weighed 77 kilos, 175 meters tall. You know everything, almost everything, but not the first and last names. I found out personally where he was from. He was from Stuttgart, Thüringen, but beyond that, I don't know more. I'm glad that such a register exists. One should do everything possible to support such registers. When you see how desperate people are when they don't find a donor. Exactly. And donors. not potential donors. I'm not talking about potential donors because only one of out of 100,000 are the real donors. The more potential donors there are, the more who are entered into the international list, the more chances someone has of finding one, right? Exactly. Do you also know that there is an age limit for donors? Yeah, sure, of course. From 18 to 35 years. Oh, very young. Yeah, for example, the mothers are all older, right? In that case, the mothers are almost never suitable, right? No, it can't be done. Because the younger the cells in the body, the more chances there are that it will work. But transplantation can be done until 70 now, right? Yeah, exactly. Yeah, but the donor cells must be young. The younger the better. So now with my mother, but my mother is 83 years old and his mother, and I told him that will not work. With a donor who is 83 years old, that will hardly work. Now, that doesn't exist. That's why one always goes to the universities, to the schools, especially in the military, it works well. In Italy, with the carabinieri, the police, the financial works, etc. Those are mostly young people between 20, 25, 26, 28 at most. And they are always monitored. They do blood tests there and everything. They are young people who also have a better lifestyle, also in their diet without excesses and so on. So you already have better quality in this matter, right? Yeah, that's excellent, right? And now after these first 2.5 years, for you it's now 4 years. So in principle, you now have a normal life. Yeah, you practically don't have to watch out for anything anymore. Probably you can't drink much alcohol and so on, but if you live a good life, then everything is okay for you. Yeah, yeah, it should be, I have met others already since 2022-23. I met one who was one of the first transplanted in Rome in the 80s, and he goes every 5 years for a checkup. And back then he still had very strong chemo, not like now. Those were much stronger drugs, right? And he's doing quite well. People like that are rare, right? Now I'm not even well. For us, until 5 years during higher level monitoring. After 5 years, it's only once a year that I have a checkup. If you make it beyond the 5 years, then that's a good sign. That just happened to me on the 8th of March. And you did the checkup, right? Yeah, I did a few days ago right now. It is even here. Wait, I'll go to get it. So yeah, I have it here, the blood analysis. You can see the most important things. The red blood cells, I now have 4,810,000. So I'm already in the normal range. Above 4,300,000 we're already in. Only the white blood cells are still a little lower. They should be, let's see if you can see. Yeah, from 4,000 or 4 million, I have 3,900,000, so I mean not much is missing. Only one thing that for me doesn't go up are the platelets. Yeah, the platelets. They are still at 100,000. They don't go higher for me. Then I asked if that's something serious, and they told me no. Especially in transplantations that are not from family, they don't rise as high anymore. But you can live well with them, so Yeah, there is a relatively new product that was approved this year. It's called mumaletinib, and they say that if you take mumaletinib, it would help to rise the platelets again. After the transplantation. Yeah, also after the transplantation, yeah. What kind of medication is that? It's a Z2 reduction agent, basically. Oh, yeah, sure. A normal MF drug, just recently released. It is given mainly to patients whose platelets are at 50,000, so they don't need so many blood transfusions, and it works relatively well. But you don't take all these things, do you? No, if you're doing well, I always think it's better not to take medications. One should let the body do it on its own so that it continues. I'm actually doing quite well, so to speak. The hospital, they didn't prescribe it for me. The inhibitor that's like Yakvi or so, but that also lowers other things. That doesn't make sense now. The rest is all okay with me. Everything is okay. That's why I say if you feel good and everything's going well, you shouldn't take such drugs. Sometimes it goes up a bit, then down again, but you can live well if the other things are fine. You have a normal life now, right? Yeah, actually, you can say normal. Actually, you can already say, yeah, I can drive again. I can do many things. Can you work again? Yeah, I started again, yeah. Started working again already last year. Have been working for more than a year now. Of course, I get help. I'm always up on ladders. I do installations for video surveillance systems with cameras and so on. And logically, on the ladder, I'm not the best anymore. But that's also age related. I'm not as young as before. I'm not 40 anymore. Me neither. I also don't go up ladders anymore. I still go up, but I don't feel as safe on the ladder as before, you understand? And you already have experience, but experience alone is no longer enough. Okay, Peter, that was really great to hear from you. I could also answer more questions, but now in principle you've asked me the most important things. You answered already the most important things. What mainly interested me was how you feel during the transplantation when it's being done, how one feels, what one can say, and also how the process is afterwards. I mean, normally doctors don't give this information. And of course, it's different for every patient. Every patient reacts a bit differently. Logical. But I would say you did a great job. I hope it continues this way.